You most likely will be doing your exercises on a bed or a day bed. Some things you want to get in preparation to do your exercises are a garbage bag, a belt of some form, such as your house coat, either a coffee can, apple juice can, paint can, and if you can't find one of those, you can make your own roll from some towels. The following are the hip exercises that you'll be starting today, working towards your surgery as well as after your surgery. The first exercise, Nancy has her leg out nice and straight and she'll be pointing her toe as if she's a ballerina and then pulling her toes up towards her nose. So point down and pull up, and you're doing 10 of those. This next exercise, Nancy pulls her toes towards her nose and tries to push the back of her knee down into the bed, making the muscle on the top of her leg nice and tight. Hold for 5. 1, 2, 3, 4, 5, and relax. The next one, you want to try and squeeze your bottom or your bum cheeks together. You're trying to hold those bum cheeks together for 5. 1, 2, 3, 4, 5. The next exercise, you need your can or your roll. Goes underneath your knee. You're pulling your toes to your nose and trying to lift your heel off the bed, and the back of your knee stays on the can. Hold for 5. 1, 2, 3, 4, 5, and down. This next two exercises, we're going to use a garbage bag to make it a little bit easier. Just makes it slippery for us. The first one, Nancy is trying to bend her knee up. And just a reminder that you can't bend your hip past 90 degrees. So Nancy is in the safe zone, but if Nancy got to here, that would be too far. So slide your knee up, let it go. And the last exercise is sliding your hip to the side. And I know this is painful for a lot of people, but if you use the garbage bag, it makes it slipperier. Slide out to the side, and then back in. Now we're just going to review how to get out of the bed following your hip replacement. Remember that you're not able to cross your legs over each other. Nancy needs to come a little bit closer to the side, so you have to lift your bum. There we go. And you're not able to cross your legs, so you can either hold your pajama bottoms and hold your leg and get up, or you can use a strap as a belt, or they do make a tool. It's sort of a coat hanger, and you can buy these at most vendors that helps you get your leg over the side. Remember that your knee is okay, so that you're sitting, you can bend your knee once your foot is on the ground. Before you start to walk, you want to take a few deep breaths because you may be dizzy when you first stand up. Your therapist in the hospital is going to put your walker in front of you. So we're going to bring her legs to the inside. After your head feels okay, you're not feeling dizzy, we're going to stand up with the walker. The way to measure a walker is when you're standing, I want to measure from your wrist crease to the ground. So I'm going to get Nancy to stand up. She's going to use her hands on the bed. Bring your good leg underneath her and stand up. And when Nancy is standing, the walker should be where she wears her watch. So you measure from the floor, the height from the floor to the handles. When Nancy starts to walk with the walker, she's going to put her hands on the grips. She's going to push the walker forward, move her operated leg in between, push with her arms, and take a step. It's almost like the wedding march, those first few steps. It will take a few days before you become comfortable enough to alternate more freer. So when you're more comfortable, you can start to alternate so that your legs alternate and you're taking a space between the two steps. When you are ready to progress to your cane will be the same height as your walker. If you've had surgery on your right leg, you'll be holding your cane in your left hand. So we'll push up off the bed. When Nancy stands, we measure the cane the same way. Your hand goes down, should be where you wear your watch. When we walk with the cane, it will be the cane and your operated leg at the same time. So left hand, right leg, and at first you'll catch up to it, and then you'll start to alternate a little bit further so that your non-operated leg will step through. So when you're ready to progress to the stairs, on the way up the stairs, you will be using your good leg first. So your good leg, and then your operated leg and the cane come next. Good leg, then the cane and your operated leg. Good leg, cane and the operated leg. Good leg, cane and the operated leg. At the top of the stairs, you'll turn around and your cane will switch hands now. And bring yourself closer to the railing. On the way down, it is your cane and your operated leg that come first, and then your good leg. Cane and the operated leg, and then your strong leg. Cane and the operated leg, and your strong leg. So when you do the stairs, it doesn't matter what side your railing is on. You're going to use your railing and your cane. On the way up, you'll be using your strong leg or your non-operated leg first. And on the way down, your cane and your operated leg will lead. Thank you for watching. Work hard, do your exercises, and we'll see you following your surgery.
If you have a standard height toilet, a raised toilet seat will help you get on and off the toilet easily. This one comes with arms. If you do not have room for arms, you can get one without arms. You need approximately 22 to 26 inches of clearance. Also, this just clamps on where you can tighten. Make sure it's solid before you sit on it. If you have just had a hip replaced, make sure that your hip is higher than your knee. Now this is a bathtub transfer bench. This bench makes getting into and out of the bathtub easy and safe. What you would do is walk up to your bathtub, go on the seat with your bottom first, slide in, and then swing your legs in. A handheld shower makes it easier to direct the water to you. So the bathtub transfer bench comes with the handle either on the left or the right side. So when you go to purchase or rent a bench, make sure you tell the vendor where your shower head is located in your bathtub. If you have a very small bathroom, if you have shower doors on your bathtub, or if you have a walk-in shower, a bath seat may be more appropriate for you. If you have a small space in your shower, then a bath seat without a back will fit. If you have more room, and for the bathtub, a bath seat with a back. So as you lean back, there's less risk of falling.